As we prepare to move into the new year, we all have a lot to reflect on from the year we're moving out of. Obviously, 2020 was a tough one for all of us due to the COVID-19 pandemic. It was not easy, and we're all tired. We all feel run down by the demands of this year, but we can all carry a bit of hope that this new year is going to be brighter than the old. We're learning a lot more about COVID-19 every day, and we've come a long way from that day in March when I announced the first presumed positive cases of COVID-19 in Pennsylvania. Our country was unable at that point to reliably test for the virus in the earliest days of the pandemic. And now 2 vaccines, lots changed. 2 vaccines have been approved for use in the United States. And the federal government's Operation Warp Speed is working to distribute the vaccines that have been approved to providers all across the country. We've learned how to treat patients who contract severe cases of COVID-19, and then we learned how to treat them even better. Recovery rates are improving, and people aren't staying in the hospital as long as they were at the beginning of this pandemic. But COVID-19 is still deadly, and it still poses an immense danger to our healthcare system if we allow it to get out of control. Still, there's good news. As we await the vaccine, we wait for it to be available to all of us. Now, I don't want Pennsylvanians to have false expectations. Unless the vaccine distribution from Operation Warp Speed increases rapidly, we anticipate that it's going to be months, not weeks, until the vaccine is available for phase 3 distribution to the general public. Right now, we are prioritizing, obviously, vaccine distribution to the most vulnerable, our healthcare workers on the front lines, and to those who live and work in congregate care facilities. The rest of us are going to need to be patient until it's our turn. In the meantime, we can follow the progress of vaccine distribution in Pennsylvania through the Department of Health's vaccine dashboard, and that just launched today. So that's news, and Secretary Levine will talk a little more about that. But that dashboard will provide the number of vaccinations administered by county all across Pennsylvania, as well as demographic information about the people being vaccinated. It's going to help us visualize how many people have received the vaccine, and it's going to help us work toward our goal of providing the vaccine to everyone in the state who wishes to receive it as quickly as possible. This dashboard and the vaccinations it tracks are just 2 more tools in our toolbox as we stand united against COVID-19. But again, the fight against this dangerous disease is not over. We all need to stay the course, and we all need to continue to do everything in our power to slow the spread of COVID-19 safe. There have been some positive signs lately. Our statewide percent positivity rate went down this week for the 2nd week in a row. And while the number of hospitalizations and deaths remain entirely too high in Pennsylvania, it appears that the number of new cases reported each day has plateaued. That means that our mitigation efforts over the past several weeks have done what they were intended to do. And I thank everybody who abided by the restrictions put in place to protect us. The point is that every time each of us makes a small decision to avoid risk or takes steps to make our actions a little bit less risky, we're helping to stop the spread of this virus, and we're saving lives. So I am announcing today that the time-limited mitigation orders that went into effect on December 12th will expire as planned on January 4th at 8 a.m. That includes 10-person indoor and 25-person outdoor gathering limits. It includes the ban on indoor operations at restaurants and bars and gyms and entertainment venues, and the suspension of extracurricular activities. Now, this does not mean that we're out of the woods. Not by any means. We still have significant mitigation efforts in place. All mitigation orders that were put into place prior to December 12th, they remain in effect when the time-limited mitigation orders expire on the 4th of January. And so what remains includes, not exclusive, but includes the mask wearing requirements, that stays. Gathering limits based on venue size, that stays. Business capacity limits, that stays. And restaurant self-certification, all those things stay in place. We need to continue to work together to slow the spread of COVID-19, because if we get complacent and let case numbers begin to go back up, the danger to our communities, to our families, to our healthcare system will return with swift and deadly consequences. We have to continue to monitor the spread of COVID-19 in the Commonwealth closely in the coming weeks, and we will do that. But we can all have hope that next year we're going to be in a lot better place. We're going to have a lot brighter ending than the ending that we have in this year. And that hope should energize us to keep our guard up and continue the fight against COVID-19 in the months ahead. By working together, we can keep one another safe while we wait for the vaccine that is on the way. Thank you. And now I'm going to turn things over to Secretary Dr. Levine. Rachel.
Thank you, Governor Wolf. The vaccine dashboard available now is a great new tool for people to be able to follow the administration of the vaccines in Pennsylvania. And as you stated, we are working to get everyone who wants a vaccine vaccinated in our Commonwealth, starting with healthcare personnel identified in Phase 1A of the interim vaccination plan. I would like to offer some sincere thanks to the hospitals, the health systems, the federally qualified health centers, and our community and municipal and county health department partners, and really all of the brave personnel who have started this mission of vaccinations over the last number of weeks. Now that vaccines are able to be shipped to more locations, we are working to address the vaccination of healthcare personnel who are not affiliated with a hospital or a health system. So effective January 6th, 2021, today's order requires vaccine providers, those that I just discussed, to designate at least 10% of their vaccine shipments for those non-affiliated providers to ensure that there is supply available to vaccinate this clinical population of healthcare workers. It also requires vaccine providers such as hospitals, health systems, federally qualified health clinics, pharmacies, etc., to set up a point of contact for these non-affiliated providers to register for vaccination appointments. Now, many locations receiving vaccine have already voluntarily begun vaccinating these providers, and we are very thankful for their efforts. But today's order formalizes this process and works to eliminate any confusion between the vaccine providers and those healthcare personnel in Phase 1A. Getting Pennsylvanians immunized with a safe and effective COVID-19 vaccine is an essential step in working to reduce the number of virus-related cases and deaths. Now, we estimate that there are nearly 1 million healthcare personnel across the Commonwealth that qualify for vaccination in Phase 1A. And so it will take time for all of them to get vaccinated. It probably is going to take a couple of months. It is important to remember that our vaccine allocation from the federal government does fluctuate from week to week, and the delivery schedule fluctuates. This makes planning challenging, but it also means that it is going to take time to administer the vaccine. Our healthcare heroes are not only working to vaccinate critical healthcare personnel, but they're, of course, caring for patients who are currently in the hospital. It is hard to ask people to be patient as we take on a task that, once again, has never been done before. But patience is exactly what we need. Now, for those individuals in Phase 1B and 1C, as delineated by the ACIP, the Advisory Committee on Immunization Practice from the CDC, this is how you can start to get ready for when we start that mission of the vaccination process. Talk with your healthcare provider. Make sure that you don't have a medical condition that might put you at risk, such as severe allergic reactions to other vaccines, medicines, etc. Please continue to wear a mask, wash your hands, and social distance to prevent becoming infected from COVID-19. Download the COVID Alert app to make sure that you could get an exposure alert notification if you are exposed to COVID-19 from someone that perhaps you don't know. Avoid social gatherings, even small gatherings, which can spread COVID-19, especially this week where we have New Year's Eve and New Year's. Visit the vaccine section of our COVID-19 website to see the latest updates to the vaccination plan. Now, please remember, as we are starting this vaccination process, it will still be months before manufacturers produce enough vaccine to immunize the general public. There are 2 safe and effective vaccines that are available now. Perhaps there'll be more as 2021 progresses. We don't know. But it is going to take time for the manufacturers to produce and then for Operation Warp Speed to distribute that vaccine. So mitigation is more important than ever. We cannot let our guard down. We must continue to follow our personal and collective responsibility to each other to prevent the spread of this contagious and dangerous virus. In the meantime, until everyone can get vaccinated, we need people to wear a mask, wash their hands frequently, stay home, avoid gatherings, social distance, and download the COVID Alert PA app. And now the governor and I are pleased to answer questions.
Thank you, Secretary. Our first question is from Jan Murphy from Penn Live. Jan, go ahead and unmute yourself.
Good afternoon, and thank you again for doing this. I was wondering, Governor, since you're going back to how things were on December 11th, if you were a restaurant or bar owner, would you be making plans to host a Super Bowl special on February 7th or, advertising a Valentine's Day special on February 14th? Since they do need to do some planning, and just wondering what your thoughts are and any guidance you can give them.
Yeah, here the guidance I would give them is that the virus is going to be what it is. In fact, I think Rachel's probably going to talk, or there may be a question on this new strain that is even more contagious. I think what happens on February 7th depends on how fast the vaccine rolls out. What happens between now and February 7th depends on what we do to make sure that this virus does not overwhelm our healthcare system. There are a lot of contingencies out there. A lot can happen. Hopefully good things that can happen between now and then. But I think we've got to, and I think Secretary Levine is right in sort of looking at this from the worst possible angle, and that is we don't know how many vaccines are going to be made available. We don't know how fast we can roll this out. We don't know how fast the pickup is going to be on vaccines, and therefore we don't know how our healthcare system is going to be able to accommodate whatever happens. So between now and February 7th, a lot of things can happen. So I think in this year, it's like everything else. But that virus is still out there, and as long as that virus is out there, that's the constant, that's the constraint that we're all operating under, and we all have to take account of that deadly reality.
Well, and along the same lines, I was wondering if you could offer some thoughts, either of you, about whether school officials should lean towards resuming some kind of in-person classes after the holidays, since our positivity rate has been going down for the second week in a row.
Well, I'll let the secretary talk about the healthcare aspects. From the educational point of view, we need to get our kids back in school as quickly as possible. We need to make everybody safe, but I think everybody, parents, teachers, citizens, we're all concerned about the learning gap that has occurred already as a result of COVID-19. We had to make some really tough decisions. And some among the toughest is what we've done to interrupt the education process for our fellow citizens, young and older. We have got to make sure we do everything we can to address that learning gap. That affects us all. It's going to affect us all for a long time to come if we don't do something to address it. So I would hope that all of us, the Department of Education, the Department of Health, and the schools will do everything they can to make sure that the schools are safe so that we can get back to the process of educating our citizens. Secretary Levine, you want to add anything to that?
Well, thank you, Governor. So, of course, we do have guidance already in terms of the community spread in a county and the recommended school teaching guidance, depending upon that, whether it's going to be in person, whether it's hybrid, or whether it's remote. We do continue with discussions with the Department of Education and other stakeholders about any revisions, but to date, there are no revisions. But I'd like to emphasize what the governor said. The best way that we can get students back into the classroom is for everyone to follow the mitigation advice that we've been discussing today. If you wear a mask when you go out, if you wash your hands, if you social distance, stay at home as much as possible, avoid in large and small gatherings. That's what everyone can do in Pennsylvania to decrease the amount of community transmission there is and thus help students and teachers.
Next up is Amber Gerard from WJAL. Amber, go ahead and unmute yourself.
Can you hear me?
Yes.
Okay, great. So my question is kind of focusing on the restaurants, Governor. I've been going to a lot of these restaurants. There's hundreds of restaurants that are not abiding by the mandate. They didn't, and they are, heroically going against it, so to speak. So my concern is we saw an uptick in cases after Thanksgiving, and now we have Christmas, and we saw that there was a record of travelers to and from, in and out of the state, and people who clearly do not want to acknowledge that social distancing, and we see it in restaurants. Is it a good idea to open up again if we're already having an existing problem now? And what if this rolls around, it ends, you open everything back up, and now all the people from Christmas, all that just kind of floods into the air. So what do you say about that?
Well, first of all, most of the restaurants actually did abide by the. So I'm not sure where you're seeing hundreds of restaurants. I'm not seeing that. The statistics are that the case count, death rate, hospitalization rate has all plateaued, and this is after only 2 weeks. Now, this is during the heaviest part of the Christmas, New Year's, Kwanzaa celebration season, and the hope is that by next Monday, that will have had the effect of actually flattening the curve. From that point on, I think we need to make sure that we're all doing everything we can to keep that curve from popping back up again until we get the vaccines out there. I have every confidence that we will do that, and I have every confidence that the mitigation efforts that we put into place back on December 12th will actually work. That the limits that we had then will continue to do good things. We didn't do as much as we did back in Thanksgiving, as much as we did for the Christmas, Kwanzaa, New Year's week. And this 3-week period really was a lot more focused mitigation. But the hope is that the combination of the vaccine, continued mitigation based on the December 12th issues, and a heightened and renewed sense of responsibility on the part of all Pennsylvanians will actually do what we have to do. In terms of the economic hardship, I keep saying this, the economic hardship that this pandemic has caused, this virus causes to restaurants and bars and businesses like that. My hope is that the General Assembly and I can quickly come to some financial ways to support this industry that has been hardest hit. I know the federal legislation does include real money for restaurants and bars and other small businesses that have been especially hard hit by this. And I think that's what we need to do. Again, I keep saying we can't ignore the reality that virus is out there. And whatever we do, this is not me, this is not Secretary Levine talking, this is the virus saying, I'm going to get you. And we're taking a risk that I don't think we ought to be taking. And to the extent we wear masks, we wash our hands, practice social distancing, stay home when we can, telework when we can, do all those things, that we're not going to see the kind of upsurge that we saw back in October and November. And the hope is that the flattening that we're seeing right now will continue into January and up through the point that we get the vaccines. Secretary Levine, you want to add anything to that?
Sir, there are 3 points I'd like to make. First is, as you pointed out earlier in your speech, we are not relaxing all the mitigation orders. Many mitigation orders continue. What are lapsing are the mitigation orders that you put into place on December 12th. So other mitigation orders and limitations can continue. The second is that we have a tremendous opportunity to prevent that increase from occurring in January right now, today, tomorrow, Friday, Saturday, and Sunday. If we basically stay home and go out as little as possible, don't participate in gatherings, don't have large parties, then we can prevent that from occurring. Hard to predict the future, but I think that what we need to do is emphasize what we can do right now.
Thank you. Next up is Chris Mamula from the Post-Gazette. Chris, go ahead and unmute yourself. Try that one more time, Chris.
I think I got it there. Thank you, April. Governor, thank you for being available this afternoon. I appreciate it. The question I had to do with the delay that you mentioned earlier in getting the vaccine rolled out. Specifically, I'm interested in your suggestions or some thoughts about what could be done to speed that rollout and some of the things that tell you that it isn't being done as quickly as it could.
Well, I'll let the secretary talk about that. My own view is that we want to get this out as quickly as possible, and we need support, financial support from the federal government to help with the logistics and the communications effort. We need to make sure that the manufacturers are sending the vaccines out as quickly as they can get them out. My own wish would be that I could snap my fingers and everybody could have access to the vaccine today. But that can't happen. That hasn't happened. It's not going to happen. And absent that, the faster the vaccine gets rolled out, the better. And I think been personally disappointed that maybe my expectations were too high, that the vaccine would have been rolled out faster and in a much more efficient manner than it has been. Now, I understand there's a handoff between the outgoing presidential administration and the incoming one, but my hope is that we can get these vaccines out, and that we don't have what I hear we have vaccines sticking around warehouses when they really ought to be going out and getting injected into people throughout states all across the country. Rachel, you want to add to that?
Thank you very much, Governor. So first, in terms of expectations, I think the expectations set by Secretary Azar that 20 million doses would be given essentially by tomorrow were always unrealistic in terms of just the challenges of this unprecedented program, the distribution partners throughout the entire country. In Pennsylvania, we have administered today, we put out 96,045 doses for the healthcare worker part of 1A. In addition, the Federal Pharmacy Partnership received just in fact, some of it even hasn't been received. 39,000 doses of vaccine that's being administered to the residents and staff of the long-term care living facilities. Now, there are more doses of vaccine that we are received at the end of last week, and we are receiving, and we have every anticipation that the healthcare partners that we have, the hospitals, the health systems, the FQHCs, our community county and municipal health department partners will be administering them absolutely as fast as they can. You also have to remember that because of how this is rolled out, it's been rolled out during the Christmas and now New Year's holidays. And we had a storm a week or so ago. So there have been some challenges, but I think that you will find in Pennsylvania and throughout the nation that as we enter 2021, the rollout will continue to improve, become more efficient. And in Pennsylvania, we certainly stand ready to immunize everyone according to the schedule set by the CDC that wants a vaccine.
Thank you, Secretary.
Next up is Ron Southwick from Penn Live. Ron, go ahead and unmute.
Okay, good afternoon. Governor, I wanted to ask just about your thought process in lifting the restrictions on January 4th, because you mentioned the flattening of new infections, but you also mentioned hospitalizations are still high, deaths are still high, and even the percent of positivity rate is still very high too. So, I mean, did you give some serious thought to extending these restrictions beyond January 4th? Was that something you were giving some serious consideration to?
Well, I was always giving consideration to things to do to keep people safe. But I announced that I would make this a 3-week mitigation effort, and I wanted to do everything I could to stick with that. I think we have seen flattening of the curve. You're right. As I said in my comments, it's still too high. Hospitalization rate is too high. We keep tracking the capacity of our healthcare system and believe that the hospitals are still in position all across the state to handle the surge that we've seen. But you're right, the hospitalization rate is still high, and it's too high, but it's lower than it was at the peak just a few weeks ago. The death rate, we had some catch up to do with the numbers coming in over the holiday season. We'll have the same thing over New Year's. But that has actually decreased from where it was a few weeks ago. So the mitigation efforts seem to be working, and the hope that guided my decision was that what we did was especially targeted on that really peak period of the holidays, Christmas, Kwanzaa, New Year's, and that what we have done during this period will actually help us in the months of January and February. That's obviously a tough decision to make, but that was the thinking that I went through in terms of making it. Rachel, do you want to add anything to that? Okay.
Next up is Ford Turner from the Morning Call. Ford, go ahead and unmute.
Hi, Governor. I wanted to ask a question about virus death counts. Some lawmakers in another state are pressing for an audit related to COVID-19 deaths. And here in our state, you vetoed a bill a few months ago, approved by the legislature, including many Democrats, that would have caused coroners to be more involved in these investigations of COVID deaths. Do you feel comfortable the death counts that the administration is presenting are entirely accurate?
Yeah, I do. As I said, now that accuracy is you have to keep in mind that coroners and healthcare systems, things slow down over the holidays. So this past weekend, Christmas weekend, we didn't get the reporting. It came in a big bundle over the last 2 days, and I guess that'll continue through tomorrow. I'm sure the same thing will happen in New Year's, but outside of that kind of thing, I think the numbers are accurate, and I feel confident that we're making our decisions based on really good information. Again, Secretary Levine, the Department of Health is closest contact with that information, but I think you share the same confidence in the information.
We have great confidence in our electronic death reporting system and our death numbers, as well as the different analysis that we put out weekly in terms of, for instance, comorbidities and demographic information about the tragic deaths due to COVID-19. So as the governor said, there are sometimes variations, especially with the holidays. I mean, when we report today, 300 or so tragic deaths, that's not all deaths that happened yesterday. That's deaths that that the reporting came in yesterday that we're then putting out today. But we have great confidence in our data and our team that works on the death reporting system.
Next up is Flora Pastorero from Penn Watch. Flora, go ahead and unmute.
Thank you. Good afternoon. My question is for Governor Wolf. Governor, we had more than 70 restaurants that were ordered to close for violating your mitigation orders. How will this affect those restaurants that were ordered to close, that you're lifting these restrictions as of Monday? Can these restaurants reopen on Monday as well?
Again, I'm not a lawyer, but I think the restaurants, all restaurants are in the same category. If the restaurants we're going after for violating the mitigation efforts during those 3 weeks, continue to prosecute and seek enforcement. But as far as I know, all restaurants are in the same category as of 8:01 a.m. on January 4th.
And I think that a lot of these restaurants they're kind of on pins and needles, not knowing what's going to happen next. If things change, would you go back and resume these temporary mitigation orders and go back again and prohibit indoor dining and close gyms again?
I have no idea what I will do in the future. As I say, we're all working in uncharted waters here. We do have a vaccine, and the faster that vaccine can get into the arms of people in Pennsylvania, the sooner we're going to be through this any mitigation effort. But none of us knows what's going to happen between now and a month from now. So I just don't know. What I'm trying to do is figure out how we can move as quickly as possible through these mitigation efforts and back to life as normal. Unfortunately, we're all being constrained by the reality of that virus.
Our last question is from Mark Scolforo from the Associated Press. Go ahead, Mark.
Hi, good afternoon. Thanks for doing this. So Pennsylvania has received some vaccines, not a lot, but even those have far outstripped your ability to get them into people. What are you guys doing to increase that capacity a month from now, 2 months from now, when we will have many more vaccines and still this, and if we don't have this different infrastructure, it's going to go excruciatingly slow. Can you call out the National Guard?
Yeah, we'll take a look at that as we need. Right now, just Mark, to keep in mind, the reality is that the logistics goes from the federal, actually from the manufacturer to the institutions designated by the federal government, healthcare system, hospitals, long-term care facilities, the CVS and Walgreens. Their logistics systems are the ones that are really being tested at this point. The state is not directly involved in the logistics yet. As we move into broader distribution, we can take advantage of public health officials throughout the state, at the county level, municipal level, and at the state level. But right now, what you're seeing is to the extent it's not going as fast as some would like it to go, it's really a function of what's happening in terms of the coordination and the distribution, the logistics efforts that's beyond the control of the state. Rachel? Are
you building up that capacity for when the state is going to have a direct role in this?
Yeah, I think. Well, we're doing everything we can. We have actually, back since this pandemic began, tried to build our capacity. But I'll let the secretary talk about that.
All right, thank you, Governor. So one important distinction that I'd like to make is what Operation Warp Speed said will be, quote unquote, allocated to the states, and then the difference between what we actually receive. So there are preliminary numbers that they put out. Often the final number of vaccine doses that we are going to receive are very different. And so we know that. General Perna had told us that, and he actually came out and said that a number of weeks ago. And then because of manufacturing, because of distribution, et cetera, how much actually go to the states. In terms of the exact doses that are delivered, again, there are two missions, as the governor pointed out. For the mission for nursing homes and other long-term care facilities, that is being worked out through Walgreens and CVS directly with Operation Warp Speed. So, our role is to make sure that they have the correct list of which nursing homes, for et cetera, are going to get the vaccine, and then they are working and scheduling those clinics to go out to those facilities to immunize the staff and the patients. I'm sure they're going to be doing that as fast as possible. That mission started Monday in Pennsylvania, so it's been 2 days. So it's going to roll out. In terms of our working with the hospitals, health systems, federally qualified health centers, our county municipal health department partners. I mean, we are working to make sure that they get the required doses of Pfizer and Moderna as best we can, collaborating with Operation Warp Speed. And then they are actively putting vaccine into arms. When you're talking about months later, as we get into 1B and 1C, then absolutely, we're going to need to be working with many stakeholders. We're also going to need to contract to hire personnel to be able to run vaccine clinics, et cetera, when we get to that point. The critical aspect of that is having the funding to do that. The president signed that bill several days ago. That bill contains the funding necessary for the states, territories, and cities involved with this mission to hire the personnel to be able to run those vaccine clinics. So we're in active planning for that now. But I want to emphasize, again, we have about 1 million healthcare personnel. There are probably 250 to 300,000 individuals that will be vaccinated by Walgreens and CVS. Even 1A is going to take some time. And during that time, we'll make sure we have the plans and now the funding to accomplish that mission with 1B and 1C.
Thank you, Secretary. That concludes today's briefing. A recording of this briefing will be available on pacast.com. Thank you and Happy New Year.